half-back, sign of distress, level of comfort.
Thank you. I was just about to read.
How's that?
Level of comfort.
Level of
Signs
comfort. He's
distress.
level and he's comfortable. And then I take vital signs, looking for fever, looking for high blood pressure, looking for pulse and respiration. It's about 15 seconds and 15 seconds in trauma for the pulse, and then I'll verify wait for any changes. How's that?
Well done. Out of order, -1.
No. All right, go ahead and stand up for me if you would. And you can do this as he walks in the room. So I want to inspect his ankles and his feet. And I inspect both sides. I'm looking laterally. What am I looking for? Pes planus, pes cavus. And then I look at the lateral ankle for swelling and deformity. And I'll have him sit down for the last part of this, and I'll do the same as standing. I'm looking for pes planus, pes cavus. Now I look again while he's seated, scoot back just a tad, take and suspend. You might want to kick this in just so you can see ankles and so forth well with that. And I do the same thing. I'm inspecting for pes planus, pes cavus with the patient seated, and I'm observing the ankle, the lateral, and the medial side, and I observe over here, again the lateral and medial side. I'm doing both at the same time. And I'm looking for swelling and deformity, and then I look at between the toes. They were right, Nate. No.
What's up? Sorry. Where's my little stool? Oh, you got it. All right.
Yeah.
Like I said, little petri dishes.
Okay. You want to observe between the toes. You want to actually look. Pull the toes apart. And again, observe between the toes. And I want to look at the plantar surface. I'm going to raise your leg. Look at the plantar surface of the foot. And the same on the other side. Okay? What's next?
Palpate bony landmarks.
Palpate bony landmarks, and we'll start at the proximal fib. Right up here, find the proximal fibula, and tell me if any of this hurts. Palpate. I go right down the fib. I go to the lateral malleolus, and you'll start proximal, and palpate the entire lateral malleolus. And on the lateral side, where do you want to go next? Base of the fifth. Find that base of the fifth metatarsal and palpate that. And do the same thing over here. Bilateral exam and down to the lateral malleolus, proximal to distal, base of the fifth. And I suspect I palpate the medial malleolus next. And I do that proximal to distal and palpate all the bony structures right in there. Next.
Palpate metatarsal heads.
Palpate the metatarsal heads. Where are those located? Distally on the foot. And you can start at the fifth, and you want to get both sides, so get the thumb and the index finger on that. And you'll find those in there and tell me if any of this hurts. I went to Japan and I went to a spa, and this old Japanese guy gave me a foot massage, and I wanted to cry because it hurt so bad, but God, could I walk after that. It was so... And he was looking at me, he said, and I was going, he says, this doesn't hurt. And he pulled and he, no, it doesn't hurt. Stop it. And he was about 100 years old. Okay, sorry about that. And next.
Soft tissue landmarks. Laterally. Anterior talofibular ligament.
ATF, or on the lateral side. Remember, we have these three ligaments here. The anterior right here, most common sprain in the human experience. So you palpate the anterior. I bet the calcaneofibular next.
Yep.
Which is located from the fibula down to the calcaneus, and then the posterior talofib over here to the talus, and the posterior spot of the lateral malleolus, and I'm going to do the same over here. Anterior talofib, somewhere in here, and use a bunch of fingers so you cover surface area and so forth. Calcaneofibular down here, and posterior talofib. All right?
Peritoneal
Peritoneal.
tendons.
Peroneal tendon.
Yeah.
Remember that? That is the lateral.
Not today.
Patient is not adequately exposed. All right, that runs behind here, separates into three, and attaches to the base of the fifth and also at the bottom of the foot. So you just come proximally here, but posterior to the malleolus and lateral side, and out here to the fifth. Okay, that's what you're palpating with that. Do the same on the other side. Start here, go posterior to the lateral malleolus, and out to the fifth. Okay?
Go medially.
Go medially.
Deltoid, posterior tibialis tendon.
The deltoid, right here, kind of spreads out in a fan shape. And again, there's a bunch of ligaments that comprise this, but it's known as one ligament, the deltoid. So start at the medial malleolus and just palpate downwards toward the calcaneus and the posterior tibialis tendon, which is back here behind the tibia. Same sort of locale as that peroneal that you want to palpate here. Same thing, and again, the deltoid ligament and the posterior tibialis tendon. You're looking for tenderness and pain. Survey.
Achilles.
Achilles tendon. I'm going to palpate the entire Achilles tendon. Again, that's back here. And I start up pretty high and come on down the Achilles tendon. And this is the proximal insertion up here, gastros, and then down to the calcaneus at the distal insertion. And I like to really get on this. You know, you can go on both sides of it like that, but make sure you palpate this whole thing. Partial tears in this are very common to have. You just work your way down, and when you get to, so his tendon is actually starting. You can feel tendinous tissue right in here, very high. He's a specimen, though. He's a specimen.
Where does it attach?
Up here and down here at the calcaneus. There's proximal and distal insertion. Don't say attachments, say insertions,
That's what
and
I
you'll get it.
Plantar surface.
Pardon?
Plantar surface.
Plantar surface of the foot, the bottom of the foot. I start at the calcaneus and work out. Remember we talked about plantar fasciitis? And just palpate. And you can do this again. A variety of ways to do these palpations, but just make sure you touch all the tissue on the plantar surface of the foot. And again, start proximal and work distal. And you're looking for pain. Okay?
Between metatarsal heads.
Between the metatarsal heads. And that's just, you already did the metatarsal heads, now you want to go between them. Where's the Morton's neuroma most likely to be found? Between the third and fourth, right here. But I want to go between these metatarsal heads and palpate. And you're looking for pain here. You might not actually palpate a Morton's neuroma unless it's a big honker in there.
It says
No,
squeeze,
I'm
but
okay.
it wants to squeeze it.
Do we want to do the squeeze test here?
I don't know. It just says.
I didn't
between
see it on
metatarsal
this where we
heads,
squeeze.
Squeeze.
Yeah. So this is that special test for Morton's neuroma. You get between the heads and squeeze, between the heads, squeeze, between the heads, squeeze, and so forth. All four of them like that. So, want to do that for this? It says squeeze on there.
Squeeze in parentheses.
Okay. All right. So do all of them that way. So get between the heads and metatarsals and compress the metatarsals laterally like that. Yeah, not quite the specimen.
And your feet are dirty.
Oh no, dude. This is the exam where you have to wash your hands after the exam too.
This
is true. Pardon?
I can say that because you're my partner.
So we look for our various pulses here. First of all, a dorsalis pedis pulse. And remember, I like to use as much surface area you can. Found a dorsalis pedis. If you couldn't find that, posterior tibialis.
It just says to check it.
Pardon?
It just says to check it no matter what.
Check it no matter what. Okay. And finally, cap refill. And you don't have to squeeze the nails, you can, but cap refill occurs in the soft tissue also. So you can just blanch some skin distally, and it should pink up. Nails should, the rule of thumb on the ambulance was 2 seconds. I don't know if that's a for real thing or not.
Are you supposed to do every single toe, like we do for the fingers?
Want to do? Okay, cap refill in every single toe. Thank you, Denise.
Because.
Why?
You could have a thrombi in
That's
one
right.
of them.
Okay. And posterior tibialis, and then every single toe. There you go. Okay?
Range of motion.
Range of motion, and this is dorsiflexion, plantar flexion, inversion, and eversion. So go ahead and point your toes at the floor, all the way down as far as you can go, and I'll bring them all the way back, point them at your face. Snap, yeah. Okay. And now I want you to take your heel and turn it to the inside. Is it okay to do both of these same time? I don't see why not. And then turn your heels to the outside. All right, very good. Okay?
It says to do the inversion, eversion against resistance.
Okay. Both of them? I thought he did that on his own first.
It says have patient dorsiflex,
Okay.
plantar flex, and then have patient invert foot against resistance.
Okay. Go ahead and push your heel to the inside. Try and turn your heel inside. Okay. And I'll try and turn it outside. All right, very good. And same here, inside and outside. All right, very good.
Sensation. Sharp dull.
Sharp dull. Do I have a sharp dull?
You have a sharp.
Watch this. Okay, this is sharp. This is dull, you tell me. Okay, and where do we go?
Floor.
Medial aspect.
Medial aspect. All right, sharp or dull, close your eyes.
That's sharp.
And close your eyes.
That's still sharp.
And over here in the lateral aspect, little toe.
I
S1.
think that's sharp.
Okay.
You have
And
to
then,
say something for all those saphenous nerve L4 coronial nerve.
is it highlight?
Yes.
Yes. You sing it then. Okay, sharper dull.
Sharp.
And sharper dull.
Dull.
And sharper dull.
Dull.
Okay. You've done this before. Do it again. Good job.
Thompson's test.
Pardon?
Thompson's test.
Thompson's test. Now you can again, if there was a chair available, you can do it as he's kneeling in a chair. What I'm going to have to do is just lay back and roll over on your belly. And what are we trying to test for here?
Achilles pressure.
Okay, make sure his foot can move. And all you do for this is squeeze the knee and notice he plantar flexes. Even if he tries to resist, he can't do that. Irresistible. See that? That indicates probably at about 60% specificity and intact because it's not a total winner test.
Anterior drawer.
Anterior drawer. Now we'll do this in two. Go ahead and scoot forward a little bit. Okay. Do this in two. First the foot will just be neutral. I want you to relax and I'm going to pull your heel forward. I'm going to push back on your shin. Okay? And he's kind of relaxed here. And then that's how you do a drawer test. Just like that. What are we looking for? ATF laxity. Now I put it at 90 degrees and raise your foot up about here. Relax if you can. And I'm going to pull forward again like that. Make sure he's at 90 degrees. If you can support him at 90 like that. And do a drawer test for it. Do the same on the other side. Relax. Push forward. Then at 90 degrees. Same thing. Pull and push. Okay?
Talar tilt.
Talar tilt, which is if it's positive. Yeah. And we invert. Is that invert or evert?
It says
Invert.
Invert. So you hold him like this, grab the calcaneus, and you want to tilt the talus underneath the tibia right there. Just tilt like that. Does this hurt? Not yet. Tilt it that far. Okay. Should be a little higher. Yes. Okay?
Examine shoes patient wears most often. Just say that out.
Check it out. Anybody else want to examine these?
They're the shoes that they wore.
They're reefers.
And they come
Okay.